Okay, in this video we're going to be talking about the kind of the area of public policy when it comes down to the COVID-19, really when it goes down to health, because there's been a lot of different myths spread and a lot of different areas when it comes down to things such as different misinformation spread. And we've seen people go out there and spread different things out there and saying different erroneous things out there about COVID-19. I mean, I've heard the weirdest things out there when it comes down to that just alone. When it comes down to conspiracy theories, we've seen everything such as Bill Gates trying to control people through some type of operating system that goes through your veins with the vaccine. Meanwhile, he has nothing to do with the vaccine. If you actually look at these patents, Microsoft nor Bill Gates has anything to do with this. He's had a hands-off approach on this. He has. You can even see that he has nothing to do with any one of these vaccines that have been out there. Not the Sputnik V, not the AstraZeneca, not the Johnson & Johnson, not the Moderna, and not the Pfizer. These are the top ones that are out there across the globe. There's probably a couple of small ones that I probably missed, but these are the ones that are basically out there. Now, when we're talking about things that have actually been out there, where the people are saying, there's mRNA with it. Well, mRNA is basically the basic function of how it basically transfers information within the actual cells. Has nothing to do with anything else. And it's basically, when it comes down to viruses, it's basically the only way that you can actually create essentially a meaningful vaccine, really, when it comes down to being effective, because it's the only way that you can actually get the information of it. Because when we're talking about it, the actual viruses are, the best way to put it is, a virus is more like a zombie than anything else. It doesn't really react like other living organisms, such as bacteria, such as fungus, such as plants or other animals. It's really kind of on its own group. That's why when people try to infer there's some type of thing like a bacteria, and I've heard this one out there, it's not anything like it. Another thing that I've heard that's erroneous is referring to like a flu. It's nothing like a flu. That's a completely different virus. This is COVID, which is completely different, which is actually the cold, whereas the flu is influenza. Influenza and COVID are completely different viruses. They react completely differently in the system. And that's like basically saying, well, a grapefruit and an orange are both citrus, so they must be similar. Well, no, you can't compare it. If you actually taste a grapefruit and a citrus, grapefruit and orange are both citrus. So if you taste both of them, they must taste exactly the same. Well, no. If you taste an orange with it, it's going to have its own flavor with it. If you taste a grapefruit, well, in my opinion, grapefruit's nasty. It tastes bitter, like you're eating the pith of an orange. And when it comes down to it, is that's kind of how you got to treat when you're dealing with viruses. All viruses are different. Not all viruses are the same. And obviously, then you break down the strains. Those are kind of like equal to when you think of a subspecies. While they're under the same species with it, there's these variances which became subspecies. That's why when we're dealing with these things with it, we need to essentially be aware of basically getting down to treating the actual main species itself. That's why that's been always the cornerstone of the medicine. And the new mRNA technology is something that is very, very critical because it's basically a plug and replace. This is something that that has been discussed on Reason Magazine. And I think it should be discussed a lot more. And it's basically discussing that because of this plug and replace technology, that this is basically meaning that any other failures should be basically due to government failures on future pandemics, because it could do this for any other virus, which is a big thing, which means basically everything on these vaccines could essentially just be pulled out. You place the new mRNA on the vaccine, and you could basically ship it out immediately. It doesn't need to be going through any other massive regulation because the technology is already there. You've already approved the technology. That's why when we start discussing this, we need to discuss what the actual technology is. That's something that's very, very critical. And when we start to look at some of the other things like the some of the other conspiracy theories that have actually gone on with this, it almost seems like they're just trying to make excuses at this point. I've heard with it where they say that fetal tissue is being used in all these vaccines. Well, frankly, that's not true, because we know that that can't be true, because the actual cost factor, and the just on, if you use basic economics, we know that the cost factor would be astronomical, and no government could afford it, and they couldn't afford to actually manufacture it. Any person who actually runs a business knows that they're looking for the highest profit margin. They're not just going to put something in there that's not necessary for them to actually create the vaccine and get it out there. That's why when it comes down to these things, of them saying, "Oh, they're putting in these things like that'll cause you to be your mind to be red. You'll basically be a zombie for Bill Gates and all these other things." If they were to have something like that, they would be highly costly for anything like that. And it would be very, very expensive for anything like that to even exist. And they're not just going to be tossing something in there in a vaccine, in which already is expensive to produce to begin with. They're not just going to be tossing it in there free of charge, because the fact is there's a certain cost to actually produce that. There is no benefit for them producing it. What does Bill Gates get out of it financially? Nothing. If Bill Gates were to put something equal to a Windows 10 system in there, he gets nothing out of it. There's nothing with it. And essentially, if we would have some type of thing that would actually speed up the ability for the brain to process something by assisting it, that would only be a positive. So he's not going to give something out there for free. The only reason why he's actually given out his product out to these things is to actually be worked as PR for his other products. So he's not giving out these products with it, and he's not going to give out any product with it that's like an internal VR type of situation, unless you would have something lined up for you to basically buy something else. And since we've already have augmented reality products, and they're not exactly being given out for free, they're certainly not going to give out something that's internally like that for free. And that's something in which people need to realize. If they're not going to give out something equal to like an Oculus Rift for free out to people, they're certainly not going to give out something that's far beyond that technology. And I would highly doubt that we're even anywhere close to that technology if we're still at the point of like something like an Oculus Rift. And an Oculus Rift selling for, we're talking a setup between about 150 to like $300+, depending on how you get your setup. I'm just using Oculus Rift as an example of the thing with it. There's other brands of this as well with it. I'm just using that as one example. But when we start to look at this, we can see that we're far beyond the actual technology. We would have to be far beyond that technology. And if we would know the cost of that would have to be easily 5 figures. I mean, people realize just going into gaming products, when we started to look just initially, when the Power Glove came out for the NES, initially the reason why it was not exactly that effective was because it came initially from a product that they estimated that it would have cost several $1,000s at best to produce for people to actually buy. They tried to bring it down to basically being equal to about the price of the system and about the NES. And when you do that, you're going to lose effectiveness. And they knew that it probably was not going to be that effective when distributed out. They knew that it was going to be kind of lacking in function at best, and it could be a bad idea at worst. And that was what ended up happening. So the idea of producing something out there that could be essentially costing, we're talking minimum about $10,000 a person, you got to understand the cost. And this would be to actually Microsoft. If you're talking something for $10,000 a person to Microsoft, times that by about the what are we talking? They're trying to at least get 300 million people. You times that by 300 million people, and you're talking that's well above. I mean, that's well above their value. I mean, you're talking close to you're talking within the realm of like the world's GDP, of like the world's actual financial value of what it would cost. So just even being realistic on that, that's not even financially possible. They wouldn't even do that. Even if they were looking for just key people with it, there's no ability for them to do it. What are they just going to do? Oh, let's put it here. Let's put it there. They can't do that because the bottles are filled with several injections. So they couldn't do it to aim at certain key people. And it's not like they're going to say, let's aim at certain people. That would mean that that would mean you're rolling the dice. And if you're not that important of a person, frankly, with it, you would not be at risk. And especially with it, it would be for people that are pretty much more important. And if they would do it, it would be for a benefit to society, not a detriment to society. It would be for the people to actually have a positive. So they would only give it to the people who they felt are important to advance society because of the actual astronomical cost. They wouldn't be handing it out for free, and then all of a sudden with it take that massive hit. It's not some type of thing of mind control that they would be doing. That's why it's not even plausible. Because you're talking like with that cost, whether you're talking into the trillions upon trillions upon trillions of dollars, and this would basically bankrupt most of the wealthiest people in the world. And this even includes people regardless of political ideology. And you would need several people coming together just to even afford to do some type of program like this. Now, when we start to get into the ideas of such things as you're looking at public policy. Now, public policy, we need to examine what's the ideas of where countries have gone. And with this, I like to examine of what we've had on data and and also compare with making sure that country size is about right, and making sure to even it out with it. Now, obviously, we can't cover factors of such things as population density and things like that, but we can kind of get as an estimate of taking their numbers and equating it out to if we essentially plugged in their population sizes with our population sizes and just equating out the per capita numbers with it, regardless of population density. Not considering that as a fact, because usually population density is usually negative for viral spreading. When it comes down to the numbers in the United States, some people, in certain cases, they were inflated. In certain cases, they were actually diminished from the reality with it. So we can actually kind of say that the United States numbers were about even from what they should have been. Some ones were actually adding on things that shouldn't have been added on. Some people were actually covering up a lot of cases that should have been added on for political reasons for getting Trump reelected. And that was a major thing with it, and they were trying to cover that up. Other ones were basically like the CDC and the Centers for Infectious Diseases were basically pretty much rewarding places for marking things that may not have necessarily been COVID related, and some areas were basically saying, well, if someone would have came in from, like, let's say an accident, like a motorcycle accident, and they had COVID, but they were COVID positive, they'd mark it as COVID. So there were cases like that as well, and so it ends up being kind of evening out. So you can basically take those numbers and compare them with other countries as well. Just make sure that you basically equate those out with equate the U.S. numbers out with other countries. Now, and make sure the populations are even. Obviously, we can't get the density even because density is kind of a factor in which we can't really work in unless we're going to compare city to city of even density, roughly even density, and that's going to be, and then you can start debating on how the city's planning is set up and all these other things, and then you start stating about temperature and all these other things like that. But if we start to go even at basically apples to apples, and you start ignoring things like population density, we can see something such as the Philippines, which has about a one third of the population of the United States, but they've only produced about 16,000 deaths so far. You compare it with the United States, which has about 3 times the Philippines population, and they have produced about 500,000 deaths. When you start to look at that, you can actually see that when you start to look at the numbers, that equals up to be, when you start to make it even in population, that's about 48,000 deaths in comparison. And when you take that 500 divided by the 48, because we're trying to keep even amounts, you can actually see that's about 10.4 times the actual amount of deaths in the United States. That would be what we're talking about here is about 10,000%, 10,400, it's like 10,408, and like 10% of the percentage of what the United States had when it comes down to deaths. Now, yes, they did a hard lockdown. I'm not saying this is requiring not only masks but also face shields in certain times with it, and they've had extreme lockdowns, even harder than what we had here. They did not do any of the mistakes, such as putting people who are positive into nursing homes. They did not do any mistakes like that. They've have not even had access until most recently into getting supplies of the vaccine, and that's only from Russia so far and China. Those are the only 2 places in which they've been able to get the vaccine from. China first, and then Russia, they have not been able to get the vaccine from anywhere else. And that's with the way the Philippines have done it. And if you compare that with it, you can actually see that they've had far better numbers. If you look at numbers based on economic level, you can actually see that depending on the economic level with it, if you're in one of their couple top social classes with it, there's virtually no deaths. And this would be equal to like the even if you're in the what we'd call like the working class with it, which is basically non-English speaking. If you only speak like Tagalog, and if you're if you're kind of in a working class, you can still you've still not had many deaths from COVID. And this, if you look to the numbers with it, it's far rarer than the U.S. The U.S. has actually been hit very, very hard, and it's basically because of you've had a lot of. It basically goes back to what we've said before, which goes back to these conspiracy theories. And another thing with it is what I would say is that we've had a lot of politicization of the COVID itself. It's basically people, instead of viewing themselves as in self-interest, and this is another thing I think we need to go into, is instead of themselves viewing it in self-interest, they're merely protesting for reasons just to protest. They think it goes down into freedom, but they don't realize that they're not thinking about self-interest. Because the mere idea of protesting a mask doesn't make much sense. If you what it calls, I mean, your first instinct should be actually looking out for self-interest. You shouldn't be paying attention to what the government says or anything like that. You should be actually looking out for what is in your self-interest. And it's in many cases with it, it's actually it's in your self-interest to go with the mask, regardless of what the government says, even through flu season. And you shouldn't even care what they say. If you're triggered by what the government says of, well, we might have to advise people to wear masks during any type of uptick in like flu season, or if COVID has any uptick in the future with it, anything like that. If you're triggered by that, there's something wrong with you. You should actually be viewing it as in looking out for your own health with it. During the winter, you should probably be wearing a mask anyway, because of the colder temperatures, you're more likely to be susceptible to disease. Because your body's going to be trying to fight off external temperatures. And when it's doing that, this is when you're talking that your body's going to be more likely to catch something. I mean, this is what ends up happening. And you're talking that a lot of the kids are coming off of the school during this time, and sorry, but a lot of kids are kind of like petri dishes. Nothing against kids or anything, but this is just a factor that's kids, even though they're less likely to get sick themselves, they're more likely to kind of pass it along to people who have not been exposed to kids in a while, and they just end up, these people, grandparents, adults who have not been exposed to kids in a while, they just end up getting sick. And there's nothing against kids, this is just a factor of life. Because they get it with it, they're trying to build up their immune systems, and because it's being exposed to a lot of kids, and many times they live in vast different areas with it, and exposed to different bacteria and viruses amongst where they live, it ends up being kind of where schools end up being like a big petri dish, so they end up getting a plethora of things with it, and it ends up getting spread from person to person during the holiday season, especially during not as much during the summer, because you have you have hotter temperatures and it's not as prevalent. But during the colder temperatures, when it starts to affect people's immune systems, what ends up happening is people end up getting affected then. And it's a good idea during this time with it to just look out for your own health. Take things that are going to help out with your health, such as vitamin D during the whole year, and different things to improve your immunity, like vitamin C, such things as that, zinc as well, and that's some things you can do with, as well as try to cover up with a mask. If you can get an N95, that's even better. And this is really what would be best public policy. And not to say that we need to force people, but this is just what we end up needing to go toward. And this is where we end up needing to look toward when we start to look at public policy forward. Now, we can see that obviously we've had some extreme public policies in all directions. And we've had people even go on the ideas of just protesting just to protest. And I think that's insane. And when we start to look at the ideas of what's actually gone on, we can actually see that there's actually been some things that are actually kind of insane. Now, when we start to look at what COVID really is, and what the actual vaccine is, the vaccine essentially is something that we had is the proverbial cure for the common cold. And that's something that people need to kind of be aware of. People have thought throughout history that we're never going to have a cure for the common cold because COVID is the cold. You can look up COVID as anybody can right now, and you're actually going to find that when you start to look up it on any type of website that starts to actually show it, what the coronavirus is, and you'll find out that the coronavirus is the human coronavirus. When we start to look at the human coronavirus 229E, that's the common cold, or what it called, or OC43. It's also another common cold. So it's basically what it is, as well as there's a few other ones that are actually the common cold. There's other ones before, but the first one found with it was actually likely 229E is actually the first one that we actually found. That's the common cold, pneumonia, bronchitis, etc. There's other ones we found since then that was actually isolated. That was actually found in the 1930s and isolated in 1965. So that's actually the first one that we actually found. And what's as far as I know, that's as far as I know, that they've actually developed the immunization based off the original isolated one, back from the one from the 1930s. To actually develop the thing with it to deal with that, as well as I believe it's SARS. or no, never mind. It is the what do you call it? It is the it's a what do you call it? It is the thing of the new one as well, the COVID 2. So it's basically based off the common. It's based off the original one, but it's a what do you call it? But it's a strain thereof. But they call it COVID-19. That's my mistake. So it's essentially the original coronavirus, and it's what it called. It's originally based off that with a SARS that's a SARS variant thereof. And so you can see that what it called. You can see that basically. So if you can do that with it, it's basically being able to essentially theoretically. It's theoretically a dealing with the common cold, because you're going to be able to, if you're dealing with any type of strain, with the coronaviruses with it, and there, as it says right, as you can go to anywhere with it, it says there are RNA viruses that cause diseases in mammals and birds, and basically what it is with these is that they're actually, this is where your common cold comes from with it. Obviously, a couple of them have actually been SARS-related viruses as well, in which that's a severe acute respiratory syndrome, and that's like the one that was in 2002 with the SARS outbreak. That was the SARS-CoV. There was a MERS outbreak that's similar. That's a Middle East respiratory syndrome. That was in 2012. And then we obviously had another SARS outbreak with this one as well. And so if we start to look at it, we can look at it that basically all of them are really based off of this common cold. And if we start to look at that, we can see that if we want to, even if you're even if you're skeptical on the coronavirus with it, it still will have some sort of protection on other variants. And if you start to look at like the common cold, let's say for instance, is if we start to look at I'm trying to find what it calls. We can actually see that what it called. I can actually see it basically. When it comes down to it, the economic impact with it exceeds 20 billion a year just from what it calls just from the workdays missed, and then what it calls. It just costs a massive amount of what it called just when it comes down to the money when it comes down to the pharmaceutical industry, that they've had to focus so much on the over-the-counter stuff and a lot of the medicines with it. Now, if they can actually, now they've actually come up with an idea with it when it comes down to this can actually reduce the amount of negative economic effects. Now, if we can actually do this is actually something which is a positive. Now, for those going on the idea of saying that that they're worried about any negatives on it with it, this is only a positive economically, and a positive socially for the actual country. Now, this is something that we can actually look when it comes out to the country with it. Now, when they're talking about, well, how much are they spending on it? Well, if we're talking on a short-term scale with it, it really doesn't matter how much you're spending, because the fact is it's going to develop into the immune system. And in the future with it, you're supposed to be able to pass it on with it when it comes on to pregnancy. And it's eventually with it, even if we start to immunize people with it, the cost is eventually going to go down. And this is just basically with what's going to happen with it if they essentially start to get more companies that are actually developing patents for these types of drugs. And you're going to find out that the cost is going to start to drop out. And eventually what you're going to have is you're going to have a workforce that's going to be missing less time, becoming more productive, because not only were you having people miss work because of colds, you're having them come to work because of the colds, more people getting sick because of colds. And this was the issue. Now you're going to have less people getting sick. When you're having people for other types of things with it, we can actually probably apply the same ideas to the flus, to the different flu variants, and probably get the same effect. And this is something which we can actually do for public policy around the globe without having negative effects. And for any basic thing with it, we wouldn't have that. We wouldn't have the ideas of, like, let's say, like respiratory, like an upper respiratory illnesses, like upper respiratory inflammation and stuff like that, that are actually caused by, kind of related to the cold and stuff like that. And it's going to really reduce the amount of drugs that need to be produced for this, because that's become a little bit of a problem. And the only really respiratory problems that we'll probably have in the future are basically going to be allergy based. And this is going to be something in which we could potentially put money into. Now, obviously, I wish that we could actually apply these things directly to allergies, but viruses and allergies are not the same thing. Bacteria and allergies are not the same thing, and this is where our problem is going to be. But being that allergies are not going to be universal, not everybody's going to be experiencing the same way, they're not able to pass from person to person, it's going to be a far nicer thing to deal with. And when we deal with these things, this is going to be something that's going to be far more milder on the economy. And we can get people to come into work and be productive at higher rates. And it's not going to be negative on the economy. Now, there's other things to make the economy negative with it, but we can obviously get to that at a later point when it comes down to it. That's through government intervention. But that's something which we can actually discuss without the issues in the future. And that's something which we can actually talk about with the economy being to boost the economy with it, we can actually basically boost it naturally by making sure that people are healthy. And basically what it comes down to is people need not really fear this whole thing with it. It's basically when we look at it, we can see that basically the future pandemic shouldn't be an issue, assuming the government does not make massive mistakes and just basically does a plug and replace type of thing with this, gets it right out immediately, and basically just goes on there and tries to get people the vaccine, and people are not being resistant to taking it, understanding that basically it's going to benefit them and get them out there back working immediately, and that they're going to be productive. It's not something out there to control them. It's not government force. This is basically to get everybody back out there working, back out there at 100% as soon as possible. And I'd like to see them go a little bit faster than they currently are. I like to, we can have a discussion of at what rate, at what groups they should be prioritizing. Now, essentially what they should have been prioritizing is the frontline people first, the most active adults next, then they should have been prioritizing the mix of less active adults mixed with some of the active senior citizens, and then some. Then at the last, with it going in with mixing in the senior citizens, the non-active senior citizens with the kids, because of just how they're prevalent with disease, just to kind of minimize disease. And what this would have done, this would have actually kept it to being very, very fast. And what they should have done is just given approval to the whole range, instead of saying, well, I don't know if the kids can have it. Well, there's nothing in there, there's nothing in these things that are that was poisonous to kids. There's no mercury in it to begin with. When it comes down to it, it wasn't, because as we saw with it, the mercury that would normally be in these things would have been as active as a preservative for it, and these things had to be at at very, very low temperatures, and that was one of the things with it. Number two is, when they were opened, spoilage was an issue, and that's why we lost a lot of these vaccine doses. That's the major reason. And when we start to look at it, we can actually see that that we wouldn't have had these issues with it if you actually have a normal type of situation where you actually have a preservative like the mercury based preservatives that are normally in it. And that's usually a little bit of a concern when you're giving to little kids. Now, since there's no concern with that, there should be no concern with this. I mean, this just seems like they're being overly cautious with kids, as almost like they're trying to bait, like it's almost like it's feeding into some of the conspiracy theorists. And I think this is a little bit of a problem. And the fact is there's nothing in it that actually harms kids. There's a little bit of like innate plastic with it, but the fact is through most of the things that you consume during the day with it, you consume far more innate objects within your things, such as water, such as pop, such as your food. I mean, most people don't understand what they actually consume lye when they're actually consume many of these food items, such as pop, such as a lot of things, such as a lot of breads and things like that. They're consuming lye. Lye is an actual highly corrosive base, which is, you're talking, or alkaline, whichever way you want to put it, and that's actually toxic. Yet when it's used in food products, it's actually it's actually diluted in such a way that it's not harmful. Now the same thing applies to these vaccines go. There's nothing harmful in it. Pass right through. And this is something which we need to understand. It's when you're dealing with innate materials, that's never an issue. And that's where people need to understand what this is. Innate materials are not a problem. Where a problem exists is when you start to consume things that are not positive for you. And we saw, obviously, the previous president actually, I don't know if he was sarcastic or whatever, but recommending people actually inject things or consume things that were actually poisonous, and not being clear on on the specific things of what people need to consume, and that actually led to some deaths in the country, including out in Arizona, where you had people consuming fish tank cleaner which has cyanide in it, because it sounded similar to something that he was recommending. And that's very, very, that's not good at all with it, because we're talking, I mean, these are some things that you should never be recommending ever. He was recommending bleach. That's what it called. That's right around the strength of lye. And these are things that are highly poisonous. And really with it, when people usually recommend like making like homemade breads with where you need to gelatinize the surface, they usually recommend even in recipes for the home cooks, they always recommend going with something like baking soda and a mix of baking soda and boiling, because what it does is the heat actually helps fix the problem of the gelatinizing with it and helps it gelatinize a little better. Using very similar to the idea of bagels. Do the same idea as with, like, let's say pretzels or something, or a similar item like that. And when we see people trying to recommend things like that, that's why they don't want to have people deal with those types of items for food, because you can easily poison yourself. And this is why when we start to talk about policy with it, policy is very, very important, because obviously there's many people out there who aren't the brightest bricks in the wall. And they will take things that you say in a literal sense. This is why you need to be very careful, and why I found a lot of public leaders, especially in the United States, aren't very careful with it. And when they talk about like the ideas of protesting, they're not talking about necessarily of why they're protesting. Well, if you're just protesting to protest, well, you need an actual valid reason. And this is where I've differed with a lot of people, even some other libertarians. Some other libertarians I've seen protest masks and the vaccine, and it's like, well, why are you protesting? Well, they're making us wear masks. Well, why are you against masks? Oh, we shouldn't have to be demanded to wear a mask. Well, if you were looking out for your own health, would you wear a mask? Well, then they start to get quiet, because the fact is in many cases they would wear it on their own, but just because some other person says it, that sounds very, very sophomoric. Same idea when it comes down to the vaccine. Just because someone's giving out for free and someone's recommending it, I mean, it's not being mandated. And then I hear people talking about vaccine passports when the government has reiterated on several occasions they're not doing a vaccine passport. They've stated that there might be private companies that might request you showing that you've got your vaccine for you to use their services. And they said this might be a thing, so it's recommended that you prove that. Such as like airlines and other things like that. Airlines, restaurants, and stores, they might request this. And then people start saying, oh, the government's pushing for vaccine passports. The government has never pushed for vaccine passports. And this is another thing that I've seen with it out there. There's no vaccine passport. They're saying that the private marketplace might actually request these, which is not a vaccine passport. It's just basically the rules of commerce. That's actually a rule of their contract to actually do business. And it's no different than any other place with it. It would be no different than a business saying, well, we're not taking credit cards on site because I don't have a credit card reader. No different. We're either taking cash or we're taking, like, let's say Venmo or PayPal or whatever it might be, or Cash App, or whatever the one du jour happens to be. There's a bunch of those ones out there, and it's no different than that. Or no shirt, no shoes, no policy, or no shirt, no shoes, no service as a policy out there. And this is another one, and it's no different than that. And it's basically like you saying, oh my God, I can't come in there and buy whatever without a shirt on. Well, yeah, because that's the policy of the store. And it's a private marketplace. You just have to deal with it. If you don't like it, there's probably going to be another store that's probably not going to have it with it. There's probably going to be an airline that says you can go on there without a mask or without being vaccinated. And there's probably going to be an airline that does that. But the problem being, they're probably going to being that there's going to be limited amounts of seats. It's going to be higher prices. So if you want the benefit of a larger marketplace, without that, you're going to have to get you're going to either have to have a mask on or you're going to have to be vaccinated, hands down. And that's just due to basic supply and demand. And for those who don't like it with it, well, you're acting like a socialist because you basically want basically price controls. You're asking for price controls. That's socialism. And I hate to toss around those things with it, but this is not me tossing around buzzwords or just tossing around insults. I'm actually what I call explaining exactly what these are. When you're asking for price controls, that is part of socialism. It doesn't matter if you're from the right or left, whether this is an economic thing, because nationalists are just as well are just fine to work with fascism, which is another word for cronyism or a mixed economy, just as well as they are to work with on the economic end socialism, a socialist economy, which is a fully essentially planned economy. And the same thing with the socialists. When we're talking on a political end with it, they're fully, they want to work with a fully centrally planned economy, and that's what it comes down to. So when it comes down to it, the fact is with it is either side are more than willing to work with are more than willing to push for price controls because they believe in a lot of central planning in those areas and protectionism. And the fact is with it, if you have a problem with the way business works with it, well, you're not for the free market. And I'm basically going to cut it here. I'm just shy of 52 minutes, and bye everyone.